The preschool period runs from ages 3 to 5. This is where the preschooler prepares for the most significant lifestyle change, going to school. They learn cooperative interaction with other children. They experience brief and prolonged separation. They use language for mental symbolization, and they develop an increased attention span and memory. During the preschool period, physical growth slows and stabilizes. The average weight gain remains at about 5 pounds per year, and then the average height increases 2.5 to 3 inches per year. During this time, the body systems mature and they stabilize, and the individual can adjust to moderate stress and change. Now let's discuss gross and fine motor skills of the preschooler. With gross motor skills, the preschooler is able to walk, run, climb, and jump well. With fine motor skills, eye, hand, and muscle coordination is refined, and then they learn to dress, draw, so their skillful manipulation is increasing. This 4-year-old has sufficient balance to stand or hop on one foot. According to Erickson, the chief psychosocial task of the preschool period is developing a sense of initiative. So the preschooler would have feelings of guilt, anxiety, and fear if their thoughts were different from expected behaviors. They also develop a superego or a conscience. They learn right from wrong and good from bad, and it's the beginning of morality. One of the cognitive developmental tasks related to the preschool period is readiness for school and readiness for scholastic learning. This typically occurs around ages 5 to 6, and that's why school starts around that time. Piaget's cognitive theory does not include a period specifically for children who are ages 3 to 5, but the preoperational phase, according to Piaget, spans 2 to 7 years. There's a preconceptual phase, ages 2 to 4 years, and an intuitive thought phase, which is ages 4 to 7 years. During this time, there's a shift from egocentric thought to social awareness, and these children have an ability to consider other viewpoints. Language continues to develop during the preschool period. The concept of causality begins to develop, which resembles logical thought. The concept of time is incompletely understood. A long time may mean something different, like until Christmas. They associate time with expected daily events, such as before bedtime. Magical thinking is used frequently. They believe their thoughts are powerful, so they might feel guilty for bad thoughts that coincide with an occurrence of something they wished would happen. As you know, Kohlberg is the theorist associated with moral development. The preschooler is in the preconventional or premoral level, so they develop a basic level of moral judgment. They have a punishment and obedience orientation at approximately ages 2 to 4, and that's when they judge whether an action is good or bad, depending on whether it results in reward or punishment. Naive instrumental orientation includes actions directed towards satisfying their needs and less frequently the needs of others, and this would be ages 4 to 7. The preschooler has very concrete senses of justice and fairness. The preschooler's knowledge of faith and religion is learned from significant others and from religious practices. The development of conscience is strongly linked to spiritual development. The preschooler may misinterpret illness as a punishment from God. Important body image developments take place in preschool years. There's an increasing comprehension of desirable appearances. Preschoolers are aware of racial identity, differences in appearances, and biases. They also have a poorly defined body boundary. Children fear that if their skin is broken, all the blood and insides can leak out. They have little knowledge of anatomy. Intrusive experiences are frightening, such as injections or surgery. The preschooler forms strong attachments to the opposite sex parent while identifying with the same sex parent. Modesty becomes a concern. The child imitates sex roles, such as when they dress up like mommy and daddy. Sexual exploration is more pronounced, and questions arise about sexual reproduction. The preschooler has completed the separation individuation process. Stranger anxiety and fear of separation from parents are overcome. Parental security and guidance are still needed, though. Security is derived from familiar objects. Play therapy is also beneficial for working through fears, anxieties, and fantasies. For the preschooler, language becomes more sophisticated. Language is the major mode of communication and social interaction. Vocabulary increases and complexity of language increases between ages 2 and 5. Children that are ages 3 to 4 form sentences of 3 to 4 words. Children ages 4 to 5 form sentences of 4 to 5 words. This slide demonstrates nonverbal messages that are sent between preschoolers. Now let's talk about personal social behaviors of preschoolers. Ritualism and negativism of toddlerhood diminishes. The child can dress him or herself. The child becomes more social and is more willing to please. They develop internalized values and standards of family and culture, but they may begin to challenge the family's code of conduct by the end of early childhood. Preschoolers are generally able to dress themselves, but they might need some help with some more difficult items of clothing like buttons. We've talked about different types of play. Now let's talk about types of play that are common with preschool age children. They use associative play, which is group play without rules, imitative play, imaginative play, which involves an imaginary playmate, and this is usually between 2.5 and 3 years of age, and then it goes away by the time the child enters school. Sometimes the preschooler will blame the imaginary companion to avoid punishment. Imaginary playmates help to differentiate make believe and reality. They also participate in dramatic play and then mutual play with parents, and these provide enriched opportunities. This slide represents imaginative and imitative play. Preschool and kindergarten provides an excellent arena for screening the child for readiness for school. Cognition, language, social and developmental milestones, attention span, and other things can be evaluated during this time. Preschool and kindergarten help the child to learn group cooperation, adjust to sociocultural differences, and coping with dissatisfaction, frustration, and anger. Nurses and parents should remember the importance of infection control in any daycare preschool setting. When the parent first takes the child to preschool or kindergarten, the parent can introduce the child to the school and the teachers. They can share detailed information about the home environment and also possibly remain with the child so that the transition is smooth. When we address sex education with the preschooler, we want to find out what children know and think, and this helps to ascertain what the child wants to know. We want to use correct anatomic words and be honest. We want to answer simply and honestly and answer what they are asking. It's normal for children of this age to be curious about genitalia of the opposite sex. We would neither condone nor condemn, but we would redirect. Masturbation is common at approximately 4 years of age and during adolescence. If a parent is concerned about their child's masturbation behaviors, the nurse might explore and investigate. It may be due to anxiety, boredom, or unresolved conflicts, but ultimately the nurse would want to emphasize that it is a private act and the parent should teach socially acceptable behaviors. There are fears that are common during the preschool age. They might be fears associated with health care, such as loss of a body part or pain. They might be afraid of the dark or being left alone. They might be afraid of animals, such as large dogs. They might have a fear of ghosts. They might have a fear of sexual matters like castration. Or they might just be afraid of objects or people that they have associated with pain. A minimum amount of stress in the preschool period can be beneficial. Excessive stress is harmful because of their limited capacity to cope. Parents should be aware of the signs of stress in their child's life, and stress prevention is important. So these children should have a structured schedule that allows for adequate rest and preparation for changes such as starting school. Stressors could include birth of a sibling, divorce or separation, relocation, or even an illness. Aggression is defined as behavior that attempts to hurt a person or destroy property. It may be influenced by biologic, sociocultural, and familiar variables. Factors that increase aggressive behavior include gender, frustration, modeling, and reinforcement. When we assess aggression, we need to look at the quantity, the severity, manifestations, the onset, and duration. The most critical period for speech development is between the ages of 2 and 4. Vocabulary grows faster than the capability to produce words. Failure to master sensory motor integration may result in stuttering or stammering. So prevention and early detection are crucial. Parents and caregivers of children who stutter should be encouraged to speak slowly and relaxed, refrain from criticizing the child's speech, resist completing the child's sentences, and take time to listen attentively. The caloric requirement for the moderately active 4 to 8-year-old is approximately 1400 to 1600 calories. The fluid requirements are approximately 100 milliliters per kilogram, and that depends on activity, the climate, and the patient's or the child's health condition. 16 ounces of milk are recommended per day, and this can be 1%, 2%, or whole milk. The preschool child often has food habits that are carried on from toddlerhood, and that could be food fads, strong tastes. The amount of food varies greatly from day to day, and then obesity in young children has increased dramatically. The preschooler sleeps approximately 12 hours per night with infrequent naps. It's not uncommon for them to wake during the night or to resist going to sleep. It's important to have a consistent bedtime ritual. Motor activity levels remain high. The emphasis should be on fun and safety. During this period, they develop a readiness to participate in sports, and of course, TV and computer time should be limited. If there are sleep problems for the preschooler, a thorough assessment is important. They may have nightmares or sleep terrors. It's important to encourage the consistent bedtime ritual, and then slowing down activities before bedtime is helpful. Eruption of deciduous teeth is complete by the beginning of the preschool period. It's important that these children receive professional care and prophylaxis along with fluoride supplements. They will need assistance and supervision when they brush their teeth, and then the parents should also floss their teeth. To promote dental health, also cariogenic foods should be limited. Safety education is important for the preschooler because of the increase in pedestrian motor vehicle accidents. They're riding their bicycles, they're playing in the driveway, sometimes they're playing in the street. They need to understand precautions to take when they're crossing the street, and they also need appropriate protection like bicycle helmets and other protective equipment. Child care for the preschooler begins to focus on education instead of protection. It's important to verbally explain how the preschooler should avoid dangers. Children begin questioning previous teachings of parents. Children prefer companionship of peers and they enter school. So the parents need to teach and reinforce these safe behaviors. The incidence of communicable diseases has declined because of the increase in immunizations, and also complications have decreased because of antibiotics and antitoxins that are given. If a preschooler does acquire a communicable disease, it's important to make an assessment. The nurse would assess recent exposure to an infectious agent. The nurse would assess prodromal symptoms, which are symptoms that occur between the early manifestations of the disease and its overt syndrome. The nurse would also look at the immunization history and the history of having the disease. It's important for the nurse to prevent the spread of disease. Immunizations are a form of primary prevention of disease. We should also control the spread of disease through infection control policies such as hand washing to reduce the risk of cross transmission of organisms. Certain groups of children are more at risk for serious complications if they do acquire a disease. Those who receive steroids or immunosuppressive therapy are more susceptible. Those with generalized malignancies or immunologic disorders. Infants younger than 1 year or children with hemolytic disease are also examples of children at risk. Some of the examples of communicable diseases of childhood are chickenpox or varicella, diphtheria, erythema infectiosum, fifth disease, roseola infantum, and measles, which is also called rubeola. This slide demonstrates the characteristics of chickenpox. Notice the different stages of healing in the diagram on the right. This slide demonstrates the characteristics of measles. Notice that the Koplik spots on the buccal mucosa are characteristic of measles. Notice the characteristics of scarlet fever on this slide. Confirmed cases of child maltreatment demonstrate intentional physical abuse or neglect or emotional abuse or neglect. Sexual abuse of children is usually by an adult, and then the highest rate of abuse occurs with children under 1 year of age. Physical neglect can include deprivation of food, clothing, shelter, supervision, medical care, and education. Emotional neglect can include lack of affection or attention and emotional nurturance. Emotional abuse or psychological maltreatment can include destruction or impairment of the child's self-esteem. Physical abuse is the deliberate infliction of physical injury on a child. An example is the shaken baby syndrome, which causes abusive head trauma through violent shaking of an infant or young child. It's often seen in the period of purple crying, where the baby cries a lot, often in the first 12 weeks of life. Another example is the Munchausen syndrome by proxy, which is a factitious disorder by proxy or medical child abuse. What happens is They deliberately exaggerate or fabricate histories and symptoms, or even induce symptoms that require painful and unnecessary testing and procedures. If the condition resolves after separation from the perpetrator, the diagnosis of Munchausen syndrome by proxy is confirmed. Parental characteristics that predispose to physical abuse are parents who are socially isolated, young parents, or single parents. Characteristics of the child is often they're younger than 1 year of age, or they might be disabled or preterm. There are also environmental characteristics that can predispose to physical abuse. It might involve divorce, poverty, or unemployment, poor housing, frequent relocation, or even alcoholism and drug addiction. The definition of child sexual abuse is the use, persuasion, or coercion of any child to engage in sexually explicit conduct, or the simulation of such conduct for producing visual depiction of such conduct, or the rape, molestation, prostitution, or incest with children. So this includes incest, molestation, exhibitionism, child pornography, child prostitution, and pedophilia. The typical abuser is a male whom the victim knows, but it could be anyone. Siblings and mothers can also be abusers. Two-thirds of perpetrators are likely to be family members. This occurs at all levels of society. Sexual abuse offenders are 80% adults and 20% adolescents. The basic nursing care of the child who has been maltreated are identification of abusive situations as early as possible. Documentation is important. You should document the history pertaining to the incident. A thorough physical exam should be completed. The child should be observed as they interact with the caregiver. Observation is very important for these caregiver child interactions, and then also to protect the child from further abuse. To select the best answer for this question, refer to page 960. You should also be familiar with clinical manifestations of potential child maltreatment, warning signs of abuse. All the boxes that are in your textbook are very important.